Good evening, Vessels of Honor Church, and all who are viewing this short session on Because We Are in the World. Because we are in the world, saints of God, there are things that we have to manage according to the laws, situations, circumstances that we are presented with because we're in the world, and we are committed to being good citizens while we are here, even though we are not of the world. So because we are not of the world, then we do a different segment where we are looking at scripture and giving you that spiritual food that you need in order to remain spiritually healthy while we are in the world. But because we are in the world, we have to make sure we are also being physically healthy, because this earthen vessel is what holds that precious treasure that comes from God. So what we are looking at, because we're in the world, is our COVID-19 is our current focus and has really taken over the globe as the most prevalent, top of mind table talk. It is the conversation of the hour, and it doesn't matter where you are on the planet. It is amazing. We know that God is in the midst of us, therefore we remain glad. But what do these numbers look like today? So I have looked at all of your feedback, and you have indicated that this is a very good place for you to come. You're trusting me to synthesize the information for you, to tell you what I believe is most important, top of mind, and that is true. And I'm not doing that just from a tunnel vision. I'm giving you the data and the statistics from the key places that data is being looked at around the globe. So for that global view, we look at Johns Hopkins University in Medicine. They have the global dashboard, and that is that source of truth that we're looking at. And we look at the state of Wisconsin, and we always know that the state data lags behind, and they indicate that the source of truth that we use should be closer to the source of truth. So meaning we look at county data being more up to date than state data, and municipal data, or that city level data, being the most up to date, more up to date than sometimes even the county. So when I'm giving you numbers that are contradictory, the biggest gap is in the number of deaths that are recorded, and it's basically when they're recorded and where they're recorded. You see a discrepancy, but I do let you know what that is. So this is Saturday, April 4th, 2020, and I am giving you my synthesis as Dr. Bowers versus Mother Bowers. So I'm working to provide you, because we are in the world, and because I have worked very hard for a lot of years and many decades to ensure that I am trained to give you this information. So to God be the glory. I'm humbled, I'm honored, but I also want you to be confident in what I am giving you. So for Saturday, when we look at the state of Wisconsin, there have been 23,859 negative tests. So this is, remember, the state closes their data at about 4:30 p.m. every day. There have been 2,112 positive or confirmed cases of COVID-19 in the state of Wisconsin. That gives a total of 25,971 tests that have been given, which is really great. We remember we were in numbers that were less than half of that just a little more than a week ago. So we're up to having done 25,000 tests, almost 26,000, 25,971. The state is recording two numbers, a 65 number death and a 56 number death. And the 65 was after we got Milwaukee County data in and added it to the stratification. The other more interesting number is, of the 2,112 positive or confirmed cases, 588 of those have required hospitalization, and that's 28%. So when we think about the number of the positives, 2,112, 588 of those, or 28% of those, have required hospitalization. The others are doing self-quarantine, at-home quarantine, some home health assisted quarantine, but still we're looking at 72%. The majority of even the 2,112 confirmed positive are either asymptomatic or are in a self-quarantine state at home where their symptoms are able to be managed outside of the hospital. That's excellent news because we want to make sure that the ICU beds and the ventilators are available for those critical patients who need them the most. So there were, in the state of Wisconsin, because in Milwaukee County, the medical examiner confirmed the largest number of deaths in one day, which there were 6 confirmed deaths, all in Milwaukee County at 9:45 a.m. this morning. Milwaukee County dashboard is showing a total of that 2,112 confirmed cases in Wisconsin. 1,122 of them are in Milwaukee County. So when we look at the impact of COVID-19 in the state of Wisconsin, definitely more than half of those are confirmed in the county of Milwaukee. So I do always show you, I like to show you every day, the updated Milwaukee dashboard, which is going to show 1,122 confirmed cases and 34 deaths. And again, we're talking about Milwaukee County when we're looking at this particular dashboard. So let's look at that real quick. So as you see, the dashboard that I know you all are now familiar with because we've been posting it now for over a week. So this Milwaukee County dashboard, that upper left number, 1,122 confirmed cases in Milwaukee County. And now look over to that bottom left one where we're seeing now in Milwaukee County, those confirmed cases. You see the city of Milwaukee is carrying that largest number. The other thing that we're looking at, again on the right in the middle, is that's the age stratification. And remember how initially when we start looking at this data, the skewing of that curve or the normalization was really more skewed to the right, to where it was more older individuals. And then to the left, when we looked at the 20 to 40 years old, even 20 to 50, the numbers were a lot smaller. Now you see it's normalizing, where we had a significant number even in the lower age categories. When we look at 40 and we look at 50 and we look at 60, over 85 is now not that largest number. And in between that 40 and 70, we're seeing numbers of 202, 212. So we're seeing much higher numbers there, with that top left showing the number of deaths. When we look down at that line, remember we're waiting for it to stop going up so it can start curving. So what's going to happen? I could imagine that question. What's going to happen? It looks like there's no more room. Well, what they will do is broaden the dates. They'll add dates to the right. So like tomorrow or Monday, we'll see this, what is going to end up being a bell curve where it starts curving down. We'll see those earlier dates in early March. We'll see those moved over more. So we'll be able to, and they'll add more dates to the right. So we'll continue to watch that. So that's your Milwaukee County look. And I read to you yesterday what the governor has put in place as it relates to helping Milwaukee be resilient. I told you that I think it's really good, and I do. I think it is important for us to know how to manage our internal selves during this time. If you are physically symptomatic, if you have a fever, if you're having a cough, if you're having shortness of breath, don't be afraid to go get checked out. Get checked out because those are symptoms of COVID-19, especially not just if you're in one of the high age categories, but if you have anything respiratory going on, asthma, emphysema, if you are or were a smoker, if you have any type of COPD, sleep apnea, all of those things that interfere with our lungs and our breathing. More lungs and breathing. Nope, I didn't say sinus because it really hasn't been found to be an upper respiratory, and I'm by my face, specifically not touching it, practicing cleanliness when I'm always work to role model what I'm saying to you to do. So in this upper part, in the face and in the neck, is not really that aspect. It's definitely lungs. So make sure you're breathing in and breathing out and checking your respirations. So Governor Evers has put in place a process, a program, whatever you want to call it, during this stay-at-home order that is helping the citizens of the state to really become resilient. So I just talked about those physical conditions that you should be watching out for, but then also you want to make sure that you're mentally healthy. So this resilient effort, resilient.wisconsin.gov, I read that to you yesterday. I just want to reiterate that the purpose of that is really managing and maintaining our emotional, mental, and behavioral health during these times of stay-at-home orders. Good information, and we will make sure that you have that sheet posted up on GroupMe, and then you can share it where you would like. Now let's look at that global board, that massive board that Johns Hopkins keeps in place, and I'm just going to update it to make sure that we have the most current, and I'll tell you when it was updated on April 4th, 2020, and it is updated at 6:41 with 2 seconds p.m. So we will look at this data. This is the global look. Couple of things I want to show you here today. So here is that massive what's happening in the world with COVID-19. So to our left, we're seeing the number continue to climb. So today it's 1,197,405 confirmed cases. That's confirmed cases, not tests. Confirmed around the world. 1,197,405 confirmed cases. Remember, this is from 181 regions and territories that are providing their data to this particular database. Then you see in the middle the maps. Unfortunately, the United States is looking pretty red, and if you remember a week ago we had some gray places, and now very few gray. So when we come over to the right, you see the number of deaths globally that have been reported are 64,606. Remember, this is the area where the United States does not have a roll-up number. The United States is represented by different cities and even different aspects of the city. Like New York has multiple lines in here depending on where you're looking at in New York. So today I tried to scroll to a place where we could see a couple different places in the United States. You see New York there. Oh, when I refreshed it, it gave you it scrolled down. So here, hold on with me, and I'm going to come over and try to get you some other. You see how I'm moving this and how it's showing me different things. So here you see Michigan, Wayne, Michigan, 252 deaths. When I come down here, Bergen, New Jersey, 179 deaths. Cook, Illinois, 167 deaths. Oakland, Michigan, 142. So when you look at the number of deaths, the way that it's reported is multiple data points for the United States. So there's not a roll up. But if you look to the far right, total recovered, and I'm really glad that Johns Hopkins does a total recovered, because it's important to know that people are actually recovering from COVID-19. So of that 1.1 million confirmed, we have the 64,606 deaths, but also we have 246,152 recovered, and they're showing that in green being good. So if you look down 1, 2, 3, 4, 5, 6, 7 from the top, you see of that 246,152 recovered, the United States is reporting 14,652 of that 246,152. So you look 7 down, you have China, then Spain, then Germany, then Italy, then Iran, then France, and then the United States, then you have Switzerland, and then you have South Korea, Belgium. You see all that moving down, and you can scroll and you can see what each of those areas are reporting. And then our bottom right, unfortunately, we're continuing to see a climb globally. We're not seeing that curve that we want. We're ready for those yellow dots to start leveling out and then eventually going down. So that's the global look. Again, I hope this has been very beneficial for you and helpful, that I've given you the information that you have requested of me. Always give me feedback on GroupMe, and I am incorporating what you're telling me. The last thing as the sun goes down that I want to say is to remember to pray for our clinicians. Pray for all those who are working in the field, who need the proper equipment, the proper knowledge, and the wisdom as they continue to care for the patients that are coming in and out, and caring for themselves. Vessels of Honor, we want to pray for Minister Jones, who works in the respiratory area. Pray for Minister Cooks, who's working in the oncology area, and they're being called in to do things that maybe they otherwise wouldn't be doing, areas that they otherwise wouldn't be working in. Pray for our sister Nia. She is at St. Luke's and working on these, what are now these COVID-19 floors, as is Sister Smith, Sister Gwen. So as we have members that are out here as clinicians, we want to make sure we're praying for them. We want to make sure that we're not the next patients if it's avoidable. So we already know, hallelujah, anyhow, Jesus, I'll never forget, washing those hands. To both of those, washing your face. If you touch your face, wash your face, and then wash your hands after you wash your face. So things that seem like they're common sense, but common sense is not so common when we're having to watch every second of everything we do. It is my honor to be able to serve you in this capacity. I want you to know that Apostle Bowers and I thank God for you. We are able to do what we do because of you. And our goal is to serve God and make sure that because we are in the world, we are being good citizens, because we are not of the world, but our light has to shine so men and women around the globe can see our good works and glorify the Father who is in heaven. And right now, more people are asking, what in the world is going to happen if I die, when I die, if the world ends? All of those things are becoming very real and pertinent questions. So because we're in the world, we must continue to be the light of the world as Jesus shines through us. Stay well, stay warm, stay safe, stay saved. COVID is going to come and COVID is going to go. But Jesus Christ, the same, yesterday, today, and forevermore. Look forward to seeing you all at 8 a.m. in the morning on our Zoom service. God bless you. Have a wonderful evening. Until soon, love and peace.